Okay, thank you for coming along. Just to update the Victorian community on the status of the cluster that is currently underway in Victoria. So currently there are 29 total active cases in Victoria. That's an increase of 12 new cases since we reported yesterday. This includes 10 locally acquired cases, all of which are linked to the Black Rock cluster. Two of these include the New South Wales cases that the New South Wales colleagues announced yesterday, but are now back in Melbourne, completely appropriately, and are isolating here. So that means a further 2 of the cases, to bring it to 12, are in hotel quarantine. One was a member of an international air crew, and one was an international returned traveller. I can also confirm that genomic sequencing results have been received from the samples from the Victorian outbreak that has established that they are directly linked to the New South Wales cluster. There's been a total of 3,907,338 tests received. That's an increase as of the cut-off time last night of 18,337, and there are many thousands still working their way through the lab overnight. I want to thank our pathology and lab teams for stepping up to extended hours as they have. I want to also address both the border issue and the testing issues. So the border issue is now pretty settled. The Victorian border to New South Wales is closed. I want to thank the 900 Victoria Police and SES volunteers who have been working continuously to keep Victorians safe from the cluster that has been seeded from New South Wales into Victoria. I want to also acknowledge that the border closure, based on public health advice, has caused significant disruption for returning travellers and regrettably will also cause disruption for our border communities. As I think I indicated yesterday, we've been quite consistent for some time now, for 2 weeks in fact, that the deteriorating position in New South Wales was of significant concern and that the public health advice was likely to change very quickly in a rapidly changing public health environment. So we make no apologies for closing the border. It was based on the public health advice, but I do acknowledge the significant disruption and the significant implications that that has made. And we intend to work with the Cross-Border Commissioner to land precisely what the bubble arrangements will be in the next few days, as I indicated yesterday. But what we are clear about is that the existing arrangements based on the economic and education and medical supports and other arrangements that are used to support those cross-border communities will be maintained based on the driver's licence system as it's been implemented. In regards to the implications for returning travellers, the border is now closed to returning travellers. Jerome will go through the arrangements as to transit permits, which are now in place for people transiting from other jurisdictions, the ACT, Queensland, etc., and also through the arrangements that will be in place for exemptions. But be clear, the border is closed for very good public health reasons, and we do not resile from that. And in regards to testing, I want to thank the more than 18,000 people who came forward yesterday. Testing is the most important thing we can do. I appreciate the significant frustrations as on many occasions the advice from Victoria Police around traffic management and other issues was to manage people up to a certain point and based on safety advice from police to manage those by capping those arrangements. we're standing up a significant increased number of both hours and facilities today, and I would ask people to still come forward, but please be patient and understand the important role that you are playing in keeping yourself, your family and the rest of the Victorian community safe. In regards to other measures, we've seen recalling of staff to come back and assist in how we deliver some of these testing arrangements, how we make sure that the 190 sites that are now open and operating across the course of today will have extended hours in many instances. Can I urge people to visit the DHHS website, coronavirus.vic.gov.au, to monitor the best locations in which they should get tested. I want to thank again all those Victorians who have come forward to be tested, and I want to urge you that if you've got the slightest of symptoms, to come forward and be tested. Now that we are seeing a total number of some 29 active cases across all of Victoria, including in hotel quarantining, this is a very significant issue for Victoria as we head into 2021. I want to also thank the hotel quarantine teams and the teams at the airport. We are doing an extraordinary job in making sure that those people who show up unauthorised from interstate are dealt with. Jerome will go into the number of people who have been forcibly and compulsorily detained in hotel quarantining. I did want to make particular mention of two people who absconded from discussions with authorised officers yesterday, who have now apparently returned to Goulburn in New South Wales. Upon the advice of the public health team, those people have breached numerous orders of the public health state of emergency in Victoria, and they will each be fined at least $19,000 for their breaching of those arrangements. This is a very serious matter. We've established the link between New South Wales cluster and this outbreak here in Victoria. We are determined to get on top of it, and I know that requires what appears to some people to be tough measures. But the virus does not respect state borders, the virus does not respect holiday periods, and the virus does not respect many things. And we need to make sure that we stay ahead of this cluster, and we take all the necessary measures we can to make sure that we bring it under control as soon as possible. I'm confident we will. I want to thank all Victorians, all our frontline officials, all of the Victorians who have come forward to get tested, and I want to acknowledge the disruption and the contribution that returning travellers, border communities and others are making to keeping us safe.